Okay, so this is Group 2 discussion on patient-centered care. I'm Rachel.
I'm Sydney.
I'm Michaela.
I'm Landon.
And to start off, we just want to discuss, before we read these articles and watched the video, what did patient-centered care mean to us? To me, I wasn't entirely sure what it was, but I knew it involved getting the patient's opinion on the treatment that they should be receiving.
I also wasn't entirely sure what patient-centered care really was, but I kind of thought it had to do with making sure that all the decisions that you make as a clinician are directed towards the best interest in the patient, whether that's be giving them treatment or referring them, or not even treating them at all, and see if time helps heal it.
To go off of Rachel and Sid, I would have to completely agree. This is a term that I have heard before, but I didn't necessarily know what it meant.
Going off of what those three had just said, I had never really heard it like as an actual term. I've just kind of seen it with my mom being a hospice nurse and having to deal with the sick and dying. So you have to focus on patient-centered care, but I didn't realize that was an actual term, and I'm still trying to completely understand how it could benefit athletic trainers.
So I think an issue with the fact that none of us really knew what patient-centered care was is the fact that it's not really in our curriculum when we're learning how to become athletic trainers. And I think that that's one of the issues, and that's a problem in our profession specifically because we should be taking into consideration what are our athletes wanting from their treatment. What do they want to see from their rehab? Do they even want to get treatment? Like the whole ACL thing, do they want to get it reconstructed? Is it really necessary?
Even from the TED Talk, it's not just a athletic training thing. It's a general medical field type of thing where we're not taught this. Doctor even talked about us in med school in general that they're not taught this. They're not taught to listen to the patient and really try to understand what they're going through and learn more about them and how they feel about their treatment.
Yeah, and we talked about it at AT, and you just referred to it as medical field in general, but even being at the dentist, I saw it. So when I was there, one of the observations, there was one patient that was getting 6 teeth extracted, and that was the plan that day. And Dr. Myers was kind of hesitant himself when he had said 6, and he ended up turning to the patient and said, "But we'll leave it completely up to you based on how you are feeling, with how we're going and how the procedure's going." So I didn't even know what patient-centered care was, but I had realized that when he had turned to him and said it's completely up to you, and he ended up getting all 6 teeth extracted, but it was completely up to the patient at that point.
Yeah, I think a lot of times, they said, is in the classroom you learn the practical aspect of athletic training or your profession. You learn these are the signs and symptoms. This is what you should do. This is how you find out different things. But you don't necessarily learn how to build a rapport with your athletes and take into their thoughts and stuff. And like Marv said, I was at the dentist this week too, 2 days, and every time when a patient walked in, the first thing he did was he knew who they were, so he would ask about them, ask them how their family is and different things that he knew they were involved in. And it was never directly in the chair, all right, we're starting the work. And he also, today, for example, he had a patient who was getting a tooth extracted, and he was leaving the option up to her whether or not she had the socket preserved so that she could get an implant in, or if he was just going to pull it and let it close on its own, and where she couldn't have a implant. And he left the decision totally up to her. He gave her his professional opinion and was this is what I would do personally, but it's totally up to you. If you don't want to do it, you don't have to, which I thought was really cool.
Going off of that, I also was at the dentist with my last 2 rotations, and I definitely have noticed that Dr. Dan Myers is very big when it comes to patient-centered care, because there was a guy who came in and he was getting fillings, and this guy was new, and his old dentist had always given him tooth-colored fillings. But apparently an issue with these is that there's more chance for decay, and they don't last as long as silver fillings. The patient didn't know this, so when Dr. Myers was explaining, he said it's completely up to you. A lot of people get the tooth-colored fillings because it looks more natural and people don't notice them as much. He said, but since yours are in the back, I would suggesting the silver fillings because there's less chance for decay and less chance that you're gonna have to get these refilled in the future. He said, but it's completely up to you, like totally your option. And the patient was just like, wow, like my old dentist never told me that. He just always said, all right, we're doing 2-color filling. There was like no option. So he was completely unaware of the fillings that he was getting from this old dentist, and now he was being given an option by Dr. Myers, which just shows to me that Dr. Myers really knows what he's doing. He's very in touch with his patients. He knows everyone's names. He could tell you who they're married to, what their relationship, if they have kids, if so, how many. Like, he's just very in tune with his patients. And I think that's what makes him such a great dentist, is that he shows that he actually cares. Like, he's not just there to clean your teeth, take your teeth out, put in fillings. Like, he actually cares about your personal life.
And to go off of what Rachel and Sid said, I think patient-centered care can start with how personable you are. I think if you are personable, you will have like that open line of communication, which is actually the first key on getting it right. Why bother with patient-centered care as like the first key principle is like having that open line of communication.
Right.
And so like as like a clinician or AT or a dentist, like being personable, you already have this like ability, and like you're more willing, and like it's not awkward. Like, so I just think being personable might make it easier, and might be the start to have patient-centered care.
Yeah, just kind of going on a different tangent. I did not go see the dentist. I went to the eye doctor, and I felt like my experience was way different because I felt like we didn't engage patients that much. When I was there, I'm just a personal guy. I like to talk to people, as people notice. I got to learn a lot about my patients and what they were going through. And one patient that stuck with me the most was when I actually got to be with the eye doctor. And it was this 96-year-old woman. She worked here. She worked underneath President Schwab. That's how old she is.
Oh my gosh.
When she said President Schwab, I thought she just meant like Hall Counsel President Schwab. Like, I didn't even understand that's how old she was. She's a 96-year-old woman. And the sad thing is she has to take care of her husband, who's pretty much just as old. They met when he was a student here.
Okay.
So he had suffered about 2 or 3 strokes, and she is his caretaker, and she's 96-year-old. She needs a caretaker herself. So just working with the eye doctor, and she's very stressed out, and she doesn't want to bother anybody about her eyes. She doesn't want to blame her husband for anything, but she's like, I work until I'm very tired. And she couldn't say it. But she's like, I'm very tired. I can't see much. When I get tired, my eyes start to blur. And she couldn't get it out. And it started to seem like the eye doctor I was working with just started getting really just frustrated with her. And he was just like, why are you here? Why are we here today? And I was just like, dude, you're not listening to her. Like, I just heard everything she just said. She's stressed out with having a sick husband at home she has told me she's getting ready for him to die. And like, that's just a sad thing. Like, you have to be more patient with your patients. I don't know, that sounds redundant, but you have to be more understanding and hear what they're coming from. Like, really look between the lines of what they're trying to say to you, because they might not try to tell you everything because they don't want to bother you. So just kind of something I picked up from my clinical rotation.
Yeah, I was gonna say, I went to both places, and you can, like, there's a big difference between, like, how the eye doctor treats, like, not saying that what they do is wrong or bad, but there's just a big difference in between the eye doctor and the dentist of how they treat their patients when they come in and how they go about treating them. It's like at the eye doctor, it's, like, strictly business, if you will. Like, they come in, they go back to the exam room, then they go back into the other exam room, they wait for the doctor comes in, he does the thing, and then he goes on to the next patient, and it's on to the next patient. At the dentist, there was multiple times where, like, Dan Myers would be running over with the patient because he'd just be sitting in there for an extra 10 minutes just talking to him about, like, their life and, like, what was going on. And there's a couple patients out in the waiting room, and you can tell that the hygienists are kind of like, okay, like, I gotta get on to the next patient, but he just is content just to sit there and talk, like, about them and their personal life with them.
And I think that's what makes him, again, such a great dentist, is that he has built such a good reputation with people of North Manchester that people who have gone to dentists in Fort Wayne have been, like, referred through family and friends, like, oh, you should go see Dr. Myers at Manchester Family Dentistry, like, he's great, like, he's fantastic. And he's not, like, a strict, harsh dentist, like, you can joke around with him, like, I'm sure you guys, well, not Landon yet, but you will see. He is a very laid-back guy,
Yes.
and he is more than willing to give you any information that you want to know. And he's just all around a great guy, and he loves his profession, and you can tell that it shows. So going off of all of that, so do we think that athletic training has been showing this kind of care to the patients that we've seen, like just in our own AT room or in general at any other sites?
Yes and no. The reason why I say that is, like, just using my example from high school, I thought I had two very good ATs who worked there. Danny and Miho, they worked for Methodist Sports Medicine and all that. And I tore my meniscus, and they told me initially, it was like, okay, here's what I think will happen. Here's like the two possibilities or two options. This really depends on your surgeon, though, of what could happen. What we would suggest if we were your surgeon, we would like to suture it back up. The reason why they said that was so the meniscus can actually heal. It can still serve as a shock absorber, and you probably won't need knee replacement. And so the other option is you'll come back quicker for wrestling, but it's going to be a pain later. Is cut the piece out, and you're just going to have bone-on-bone contact for a very long time. The surgeon elected to cut that part out, and at the time, I was very happy about it because I could get back to wrestling a lot quicker. But this knee sucks. It hurts all the time. Hurts going upstairs, and I'm 20 years old, about like 80-year-old man knees. It sucks. So, just going based off that, yes and no. Like, if a lot of stuff, and if they were in their control, they would let the patient determine that. But I was just thankful that they gave me that sort of information.
I would have to say I've kind of seen it more in my clinical rotation this past fall with men's soccer. I always saw Kevin playing on a day-to-day basis based on how the athlete felt, and he would leave rehab on the physical, like say an athlete had like a ankle injured, if that ankle was injured, like if their pain that day was high, he wouldn't have them rehab their ankle that day. And like he got their pain scale every day, and it was like a day-to-day thing. And he would still obviously have them do rehab, like core and stuff. But I think that can also fall on patient-centered care based on like their pain and then being able to like call that day-to-day basis, like if they're willing to do their rehab, like.
I feel like here a lot of times with like more minor injuries where it's like a sprained ankle or you're just gonna rehab something, it's a very patient-centered. Where like the AT will be like, hey, like I think you should sit out, but it's up to you. Like if you want to push through it, we can tape you up and get you out there. But like with the more serious injuries, with like ACLs and labrums and stuff, it's like, okay, we're gonna have you refer you to this surgeon. They're gonna set up your date for surgery. This is what you're gonna have done. And it's like when it comes to the more serious things, it's like they want you to do what they want. But if it's more minor, they kind of like leave it up to you. Which I think it kind of should be the other way around. If it's more minor, they should be like, all right, you're going to do this to try and get better. And if it's more serious, it's a longer, like, decision's going to impact you longer in life. It should be more up to the patient than the minor things are.
But I wonder if that goes back to the whole personable thing. And so, like, we're more personable with, like, athletes are more personable with the ATs because they have that better bond and connection and that whole communication with them. To where that communication with our team doctors isn't as strong because we only see them. I mean, some athletes never see the team doctors until literally the day that they're hurt.
Yeah.
And so they don't even have that communication and they don't even know how to communicate. And so I wonder if that's where that.
My only question is, do you guys think coaching will affect patient-centered care in athletic training? And the reason why I say that is you were talking about Kevin, how he would, if there was a minor injury, he'd go up and say, hey, if your pain is kind of too high today, we're just not going to rehab today. Do you think coaches will start getting irritated if we start going to this patient-centered care, and how would we counter that? You guys know what I'm trying to say?
Yeah, I think there's a fine line between knowing when an athlete is legitimately hurt and legitimately it's like, yes, this hurts too bad, like I think I should sit out, or to where they're like, yeah, it kind of hurts, I just don't really want to practice today. And I think coaches can kind of see that too. You know, there's like different types of players, and I think we've all played a sport at some point in time. And you know, there's the athletes that are always hurt, and it's never really that bad. And then there's ones who are seriously injured and are like, no, it's fine. Like I'm gonna play through it. And I think that's a lot of it is on the athlete, and it's gonna happen whether or not you have patient-centered care or not. They're gonna, if you leave it up to them, they're gonna say, oh yeah, it's worse than it is. But if you don't even talk to them about it or don't leave it up to them, they're just gonna keep saying it's progressively worse, so that they still don't have to practice.
The other thing is Kevin. I mean, if somebody said like my pain is way too high today, like I'm not gonna like rehab. So no, it's not like Kevin wouldn't do anything. They would get treatment, like ice, obviously, rebound machine, and then they would also do like core rehab and stuff. So it's like the coach obviously sees that they're still doing something, they're still getting treatment, they're still obviously in contact with Kevin. It's not like they're just blowing off Kevin as a whole and not getting help for themselves. So
I think it also goes back to having a trustful relationship with your athletes. If your athletes trust you and you can trust your athletes, I think that builds a much stronger relationship and you're able to provide patient-centered care at that point. So if you can start off with like as Rule said, like just being nice in general to your patients. If you can build that good relationship, then providing patient-centered care is going to be a lot easier because you're going to be more willing to take in their thoughts and their opinions and what they expect to get out of their treatment.
I feel like we also see patient-centered care a lot more at the younger, like high school level, only because of you're dealing with minors, and so ATs always have to ask for like permission before doing anything, only because of minors. And I don't think it should be like that. I think everybody should always have to ask for permission.
Well, wasn't the video where he had asked his patient, like, is it okay if I touch you?
Yeah.
And she was kind of taken aback by that because she hadn't really experienced being around a male that said, like, is it okay if I touch you?
Yeah.
And I think that's something, like, we talked about, we forget to do that sometimes because we just expect it and assume that, like, it's okay to do it because they're already here. But I definitely think that's something that we should always ask, like, all right, is it okay if I touch you? You're gonna have to help me do whatever I need to do. And like you said, like if it's ever not okay, then try to talk to them to what can I do to make it an okay situation? Like, do you feel better leaving your shirt on, or would you rather see an AT of the same sex? Like, try to work with them rather than for them. If that makes sense.
But I would just say, like in like high school facilities, I think like I say that you see patient-centered care more often, but then like I also like want to take it back because I know like from personal experience, I know like my AT would kind of like go out and like be like, okay, so here's the game plan. Like he's gonna go visit the doctor, and like they wouldn't really ask like the parent for permission. They would just kind of tell the parent just to like inform them. So it's that communication, but it's not really asking. It's more of like a telling,
Right.
which is a difference.
So is there anything like that was like really interesting from the readings that like kind of like stood out, or is there anything that just like was interesting to read?
Yes. I also on the article that said the values and value of patient-centered care, there was one part that said it was like how to achieve it, and it was how like hospitals, how they have been adopting models used by boutique hotels with greeters, greenery, and gadgetry. And so I just thought that was funny. Like, but like, are you actually, with those three things, are you actually still reaching patient-centered care?
I think there's a difference between making something more intriguing, something like having like new gadgets. Like
Right.
I had gone to the doctor in January, and they had this electronic board on the wall that you could like tap on and get information about like STDs or strep throat or whatever, and like that was supposed to like keep you busy while you're waiting for the doctor. So I wouldn't necessarily call that patient-centered care,
Right.
because you're not interacting with the patient at that point. The patient's just waiting for the doctor to show up.
Patient
Right.
education.
Yeah. But I think you can also get patient education with patient-centered care by interacting with the patient and actually getting to know them. Like when the doctor comes in, they're not like, all right, let's do heart rate, blood pressure, temperature, all the basics, and then asking the basic questions like, so what's wrong? But getting to know the people and getting to know what their lifestyle's like is going to give you way more information on what could actually be going wrong.
And so the article then goes on to like changing infrastructure, and then going into like the 21st century and doing like online medical records and how this can help with patient-centered care. But the article goes on to say like how this is not patient-centered care and how people confuse the two. And I couldn't agree more. Like it's like completely different. Like that's more of like hospitality, like making sure that your patient is like comfortable, but it's not necessarily like making sure that they're like getting what they want out of what they're going to see.
And I think another thing is like what they're talking about, like in the general medical field, like someone goes into the doctor because they're not feeling well. They say, well, I think, let's say, like, oh, I think you have diabetes. Okay, you just told the patient they have diabetes. What are they supposed to do with that information? What if they don't know what that means? They can be completely lost, but if they're not comfortable with talking to you, they're going to sit there and just think, well, I have diabetes now, and I don't really know what to do. So if they're comfortable with you, they're going to feel better about asking questions, like, well, what does this mean? What am I supposed to do? And a patient-centered care doctor that practices this will be more interested in educating the patient, not just treating them. And I think education is a big part of treatment. So in order to get better, you should know what you're doing and why you're doing it. And I think that's another big thing with patient-centered care.
Yeah, I remember seeing a part of the article that was a huge thing. It was like a sample thing, or like sample questions to this 14-year-old with asthma.
Mm-hmm.
You know, he's the one living with asthma. I don't never experienced asthma. I don't have asthma, but he lives with it on a day-to-day basis. So he's going to know how asthma affects him the most, not the other way around. So asking him questions like how do you think we should handle your asthma better? You know, how does the asthma make you feel? Those sort of questions is like making it about them, because they, at the end of the day, they're the ones living with it. I've never had asthma, so who's the ignorant one here?
Who's going to know better on how to treat it?
Yeah.
I think one thing that the values and values of patient-centered care, the article, it says that it's commonly assumed that the patient is the best judge of whether an interaction is patient-centered. I thought this was really cool because like it's so true. You know, you're talking to somebody on the street and you're like, oh, like I need to go to like the elbow doctor, and you're like, oh, like you know somebody had an elbow issue, and you ask them, well, they're gonna either say, yeah, dude, he's great, you should go to him, or be like, no, you should not go to him. So it's like solely like based on whether or not they perceive what you have done as patient-centered. You may think it is, but if the patient doesn't, it doesn't really matter. And like the article talks about how like it's very common. I think it's I hear it a lot. Like at the PT place I interned at over the summer, is like these patients think that they're like they need this and this done, they need this surgery and this surgery, when really they don't. But they don't like the doctor they're going to because the doctor won't give them any more drugs, or they won't like refer them for surgery because they know that's not what they need. But the patient thinks that's what they need, so they feel like that doctor is not good for them.
I think that also can relate to AT when, let's say, an athlete comes in and they're like, oh, I need to get stim and ice done. And you're like, okay, well, why do you think you need it? Like, oh, well, it feels good, it helps me feel better. Well, if it's not really doing anything for them, like, do you let them do it because it feels good, or should you explain to them, well, here's what it should be doing, but if it hasn't been working in the past, then maybe we should try something different. So again, it goes back to educating them and saying, well, maybe we should try something else.
Yeah.
What do you think?
That was kind of like my critiques, not necessarily a critique, but like thinking critically about it is like what we seem incompetent to certain patients is like, oh, it's like they just didn't want to treat me because they were asking me all these questions because they didn't know what they were doing. So do you think as a clinician we were going to come off as incompetent to some of our athletes or some of our patients that way?
Again, I think it goes back to what kind of relationship do you have with that athlete. If it's an athlete that trusts you, then they're going to understand, like, well, they probably know best, and they know me, and they know how I deal with my pain. So I think if you have that relationship, they're going to be more willing to listen to you on what you think is going to be the best option. And if it's just some athlete that you've never seen before, they come in and they demand whatever treatment they think it is that they need, it's going to be kind of hard to explain to them, well, I don't think that this is going to be the best route. Can I try suggesting something else? And if you can't build that relationship with them, it's going to be harder to proceed with treatment for them, because they're just going to get frustrated with you, you're going to get frustrated with them,
Yeah.
and then they're not gonna wanna come in anymore.
I actually did a little bit of research outside of like our articles, and I found one that said Picker's 8 principles of patient-centered care, and the very first one says respect for patients' preferences. And so it was just kind of saying like, not to like completely go with what the patient wants, but kind of like respect what they have to say and like, what their preference is. And so along those lines, like
Just taking into consideration what
Yeah.
they want and what they
What-
expect.
what they're asking for, yeah. Obviously, it's hard like in our AT room, like if everybody were to come in and ask for stem and ice, we obviously can't sit there and treat everybody for stem and ice, but
So why or how, I guess would be the question, how should we incorporate this into our curriculum while we're still in undergrad? How are we supposed to learn how to incorporate patient-centered care into our clinical rotations?
You make it part of your clinical rotation grade, like that be one of the things that is
Yeah.
graded on by your preceptor is how well you interact, like interaction with patients, athletes is already a thing, but like how well you take into consideration how they're feeling on any given day, or if you just say this is what you're gonna do and have them do it, or if you let them kind of help make their own rehab plan and help them help you.
I would say like right now we're only graded on our competencies, and so I would say like, I mean we obviously can't add it to the competencies because that's by Katie, but like the preceptors grade us on it, but then it's hard because some of the preceptors don't even have patient-centered care, so
Maybe not even like be graded on, but just like kind of get some kind of feedback, either
Right.
whether it's from your preceptor or the athletes that you worked with, like just maybe
Yeah.
have your preceptor like, so like what did you guys think of like the students this semester? Like how did you feel about them? Like do you feel like they really cared about this? Do you think they felt passionate about being here? Do you think they really cared about how you were doing and how well you were feeling?
I mean, even in like kind of this clinical class, like I appreciate the things that we learn in this clinical class because we learn things that we don't even learn in clinical or even like from Prentice books because they're not things
It's
that
just
are
not
in
a written thing.
Yeah,
It's not something you can be graded on.
and they're new, like evidence-based practice. It's things that they're not new, but they're new ideas coming into AT.
They're like just now starting to be really incorporated into the profession. Yeah. So I think overall, kind of just to kind of start wrapping up this discussion. So I feel like we've definitely learned a lot from these readings and from talking to each other and getting each other's ideas. Overall, I feel like patient-centered care is definitely becoming more apparent and it's becoming much more important. And now that we've kind of like put a name to the idea, I think it's going to be easier to incorporate into what we do. I feel like with myself, when I go into my next few medical rotations, and then even next year with our rotation, I'm going to make it more of a point to build relationships with my athletes. Not that I haven't endeavored to in the past, but I'm going to make it more of an effort to say, so how are we feeling today? Like, how are all things going? Like, what do you want to get out of your treatment today? What do you want to get out of your rehab today?
I like that question of like what do you want to get out of it?
So I definitely think that'll be something that I take away from this.
I like your ideas, and I especially appreciate your insight. Especially, I could see this a lot working at Whitco last semester. With when you're dealing with a lot of moody teenagers, you kind of have to consider how they're feeling on that day, because there's some days where they are perfectly fine. They are in tune to doing rehab. They're like, yeah, I want to get better. I'm trying to reach this date so I can play back. It's like, all right, well, if that's your goal, then try to get you there. Then there's some days they'll come in, they don't want to do anything. Because whether it's what's going on in their home life, what's going on with school, there's just so much going on that you have to like consider what they're feeling and try to get the best out of it, like every day, depending on what your patient is feeling. So,
I feel like it's starting to become more of a prevalence and more important thing, but I also feel like back in the day it was there. Like doctors used to make house calls, like they would go to their house, and then it's like we started getting away from it where it was strictly the doctor is the doctor. You go in, they tell you what's wrong, and then you get out. And now it's kind of starting to come back to not to the making house calls extent, but like where you want to find out about the patient's life. And I know there are some doctors, and even like I know the dentist, has patients have his home number or his cell phone number because he was like, you know, if it's the office is closed, but he's like, you have my number, you can call me if you have any questions. Even when the office is closed, and I think that's like a really big thing that's happening, where they're giving out emails where they can be reached at home.
Going off of what you just said about doctors, I've noticed recently, like, and this has been going on for a while, but as like I go to like the doctor by myself, like more and more as an adult, the doctors, you have like a scheduled time, you know, like
Yeah.
2:30. You see the nurse practitioner longer than you see
Yes.
the actual doctor,
Right.
and I think that's like crazy to me. And like
The
I've never
doctor-
actually like
They come
Notice,
in, they
yeah.
do their thing, then they get out, the nurse comes in, takes you away again.
yeah, and I've like I socialize more with the nurse than I do the doctor, even though I know my doctor like personally. I still think it's like crazy.
I think like the biggest, like most important thing in the medical profession is you can't take yourself too seriously, in my opinion. Where even if you have these titles, all these degrees and whatnot, at the end of the day, it's about caring for the patient, and you have to do what's right for the patient. Don't put yourself on such a high pedestal where it seems like you're unapproachable, and really just care about what you're doing.
I think people should still respect you and what you do as a profession, but they should also still be able to talk to you like a friend. So it's, again, that relationship that you have, but there should also be that respect, but you should also respect them as a person and be willing to take in what they want and understand where they're coming from. So I really think that that's what patient-centered care is really all about.
I think it's also just about sharing that management plan through communication and respect, like having that respect for the patient's preferences, like you said before. And I know we've talked about a lot about like communication and that open line and personable with athletes. But the one thing you have to remember is like boundaries, and like not overstepping those boundaries and not being too personable, obviously.
But I also think a big part is education, which I think we talked about a little bit earlier, but like a way to make sure your patient is knowledge on what they have going on is to educate them on what they have and their options, which then in turn gives them options to decide and then be able to make an educated decision on what they want to do for their life.
Yeah, give them your professional opinion, but don't decide everything
Yeah.
for them. Let them have a voice.
And I would say in like the dumbed down version, explain to them in detail. Like,
Don't talk down to them, but explain it in a way that they will be able to understand it. Don't
Right.
just throw out
all these
medical
terms.
jargon about
Yeah.
medial lateral, whatever.
Yeah, I noticed Dr. Myers says that as well.
Yeah.
Some girl thought that she had a cracked tooth, and he was like, "It's not cracked." Like he had used some fancy term. I don't even know what it was now, but he was like, "It's not cracked. It's basically just like a line, like basically just a line that isn't all the way through." But he had like explained it to her, but he had used some really fancy word at first. But
And then I think that also just shows like how educated you are on what you're trying to explain. So like if you can't explain it on a lower level to someone else, then I feel like that shows that you don't even really know what you're talking about if you're not able to bring it down to those terms. So, again, I really think that patient-centered care is definitely becoming more important and more prevalent, and I think it's something that definitely needs to be taken more seriously and then should definitely be brought in more into our profession as athletic trainers. Yeah, good discussion.